My name is Stella Obeidi. My presentation today is managing acute postoperative pain in lower joint replacement through innovation. And my focus will be on hip and knee. In the most recent study done in 2010, prevalence of hip and knee replacement in the US indicated that approximately 7 million Americans are living with hip and knee replacement, and women top this number. Postoperative pain, as you imagine, affects early mobility, patient experience, length of hospital stay, and cost to the hospital. Also, in the same study, showed that approximately 80% of these patients experience acute pain after surgery, and 86% of these reported their pain as either severe, moderate, or extreme. Acute pain, or pain for that matter, affect cardiovascular events. Immobility resulting from pain leads to pneumonia, ileus, infection, delirium, or anxiety among the elderly. Delayed mobility, chronic pain, and possible readmission. Total lower joint is an advancement in the treatment of joint pathologies, the surgeries. Hip and knee are the most commonly done lower joint surgeries to relieve pain of because of pathologies in these joints. Therefore, uncontrolled pain may result in complications that can cause morbidity, mortality, decrease in quality of life, and of course, increased healthcare costs. In a research done recently, patients undergoing lower joint surgery stated that pain was the most concern about the result of their surgery. Uncontrolled pain, as I said earlier, affects mobility, and the longer the patient stays in bed, the longer the hospital stay, higher medical costs, more burden to the healthcare provider, and the patient pain and suffering. In doing my research for this project, I met with the team members of the surgical unit where I plan to implement this project. Amongst them are the surgeon and anesthesiologist, whom I was able to get at the same time, the director of education for the nursing staff, the physical therapist, and the patient. The anesthesiologist and the surgeon were very unanimous in their intervention approach to pain management among these patients. They both agree that patient education, is very important. They also believe in scheduled medication interval using multimodal analgesia, opioid and non-opioid, for pain management given in the first 48 hours. However, the anesthesiologists differ in this. He believed that patients over 60 years old should not be having intravenous opioids. Rather, he preferred the oral route. The surgeon, on the other hand, believed that opioid or non-opioid should depend on patient medical history and age. They both agreed that also that the amount of pain patient experience depends on the soft tissue desiccation during surgery. I was happy to learned that they both like the use of medical app at the point of care as an advancement in pain management. The education director favored the use of PCA in the first 48 hours. Thereafter, oral opioid given twice a day and the non-opioid as needed. She also told me she's already doing a surgical nursing skill simulation lab every year. She was very happy to hear that I will be using a medical app at the point of care. As the champion of evidence-based person in the facility, she was excited about me using an app for this project, and I went over Skyscape app, which I plan to use. The nursing staff also favored the PCA because, of course, it helps her with time management. Then the use of Skyscape, at first she was skeptical, but once I went over the app, she liked it. She also supports scheduled opioid analgesics after 48 hours when PCA is discontinued, because for her, that will help her coordinate all her care routinely, of course, with assessment. The physical therapist also a very important player in this group. Liked the idea of patient education. He liked the scheduled oral analgesics because to him the pain is continuous, so pain medicine should be continuous. That way he can come to do his physical therapy at any time without having to pull the nurse out of bedside to give pain medication ordered as needed. He liked the idea of a Skyscape. He loved using app, so he immediately bought into it. Then the patient also agreed that education from all levels of care was very important to her. She liked the idea of scheduled pain medication rather than as needed. She feared that she told me that one thing she feared most was waking up in severe pain after the surgery. Skyscape app I introduced to her. At first she was skeptical about using a phone or social media at the bedside, but once I spent time with her, she bought into it. So what has been done about pain management over the several years that hip and knee replacements were done? So many attempts have been made to resolve this pain. I mean, postoperative pain in lower joints. There's the standardized guidelines which are not being used by some facilities. Then we have the PCA, which is commonly used, especially in the facility where I plan to implement my project. Then the epidurals, the multimodal analgesia is commonly used also, and then the proactive planning, which include the interdisciplinary team. So why do we still have so much issues with pain after lower joint surgery, after all these attempts? So in my findings were unanimous among the team players. Patient education, they all agreed. Scheduled rather than as needed pain medication approach. They also believe in better communication among the team members, and of course partnering with the patient. So here I introduce my app which I plan to use, Skyscape app. Again, the team, they all embrace the app once they got to know it. Skyscape app is a very useful evidence-based resource as it's being researched. It's simple to use. It has a lot of medical resources, over 150 topics covered, and it's also comparable with Android and iPhone. So I say Skyscape app has disrupted post-operative pain at points of care because of its quick calculation of various drugs, easy and accurate for the clinicians to use for their scores and indices at the bedside, and of course to improve pain management decision between the patient and the providers. So it's, as an evidence-based practice, there we go. Evidence-based practice is what we need for improved patient outcome. So Skyscape is my app. And here is the summary of everything I've said about Skyscape. It is the appropriate app for pain management among lower joint post-operative patients. So as you see the sun rising in this sky, so is my Skyscape for innovation. Here are my references, and I have a short video simulation for hip and knee replacement. Thank you so much for listening.